So I farm so hard the employees wanna find me, and then wanna hire me. What's 100K to a guy like me? Could you please remind me? Farm so hard, this ain't easy. Working late nights, you best believe me. My grades can only go ace. Never wanna see another B unless I'm Jay-Z. Farm so hard, let's get
Hey guys, welcome to another Pharm So Hard Phun in the Sun. We are in sunny Chicago right now, and I'm just super excited to be at Northwestern Hospital. And again, we have a few questions to ask Kelsea for us today. But again, tell us a little bit more about yourself and really about the hospital system.
Yeah. So thanks so much for coming here today. I'm Kelsea Caruso. I'm one of the clinical pharmacists here in the emergency department at Northwestern. We're about a 900-bed hospital, level 1 trauma center, comprehensive stroke center, with 24-hour ED pharmacist coverage. So I did 2 years of residency here at Northwestern, and then I've been a pharmacist working primarily in the emergency department for the last 5 years. Really love it here. We have really worked to expand our practice and are completely involved in all of the care of our ED patients.
Perfect. Again, what's the big thing? So it's a ton of hospitals here, and I think everyone has their secret sauce or their patient population that they see.
Yeah.
What's Northwestern's like, Emma? What is Northwestern known for from a patient population standpoint?
Totally. So I think we're really unique in our location. So we're located in Streeterville in Illinois, which in general is actually a pretty wealthy neighborhood. But because of our location to downtown, we have a ton of homeless people. And so something that I always sort of say to people, and part of my job that I love, is one patient that I'll talk to maybe came in with a Louis Vuitton bag, and the next person I talk to is a homeless person living on the street. And so we really have a very unique patient population in that it's very vast, and we see a wide variety of patients.
Perfect. And that's great. So talking about the hospital system, the patient population, let's dive a little bit more into like the role of the clinical pharmacist, because with an ED, depending on where you go, it varies very differently. So can you tell us a little bit more about the role of the clinical pharmacist here?
Totally. So I would say we are almost too involved. We are involved basically from the point that the patient walks into the triage booth. If there's an issue with a patient's medication, that nurse calls us immediately from triage. We get called all of the time for somebody's pump not working, or they need a home medication out in the waiting room, things like that. And then once they get roomed, obviously our physicians start their care, and we are their go-to for any questions about high-risk medications, obviously antibiotics, anticoagulants, and then any sort of procedural things. And we're really proud of the things that we've done even in the last couple of years. If you came here 5 years ago, maybe we weren't attending every procedural sedation. Now it's become an expectation that we're there, and we're helping them to come up with doses and monitoring plans and things like that. And so we're really involved in every single step of the way. And like so many other emergency departments, we have a issue with boarding, and so we keep patients a long time in the emergency department. And our physician colleagues really look to us to help them to make sure that we're continuing important home medications. We have a really large transplant patient population here, so we do every transplant under the sun. And at least, any day I could have like 4 to 10 transplant patients. So we have a lot. And so they look to us to help them to make sure that we're continuing immunosuppression and any important home medications. And then if the patient is safe for discharge, we have a lot of programs to help with discharge counseling, particularly in our patients who are diagnosed with a VTE on discharge and going home on anticoagulants. So we counsel them, and then we actually have a program where we follow up with them. We do MyChart messages through Epic, and so we send them a MyChart message 2 days later to ensure that they were able to fill their medication, that they didn't have any insurance issues, and that they could actually start their treatment. So those are some programs that we're really proud of.
And that's big. That's all that in addition to the things we usually do, the medical emergencies,
exactly.
the traumas,
yes, that's adding on to every intubation, to every cardiac arrest that comes in, every STEMI.
Perfect. So can we kind of shift to your residency program? Can you kind of walk through like the PGY1, the numbers, and then the PGY2 programs that you guys have?
Yeah. So we have 12 PGY1 residents, and then we have a large group of PGY2s. I think we have 6 right now. They kind of flux every year. And then newly we have the combo, like PGY1, PGY2 admin residents. as well. And then we have a PGY2, obviously, in emergency medicine. The last years in the beginning of the program, it's actually a residency that's been sponsored through Rosalind Franklin University, their College of Pharmacy. So we have a really strong relationship with them, and it allows our PGY2 resident to have a lot of experience in academia and do a lot of teaching. So they do a lot of teaching within the toxicology elective and do a lot of sim stuff with them, which is really cool. And then for our PGY1s, we are an elective rotation, so we offer it to everyone throughout the year. Roughly, we would, there's how many months? 10 months to fill. We probably fill 7 of the 10. So it's definitely a highly sought after rotation. We do have to be strategic about scheduling and things, especially to prioritize a PGY2, and we have a PGY2 in critical care. But we're lucky in that we have 24-hour pharmacist coverage, so we've definitely used that to our advantage for trainees and put people on all shifts.
Perfect.
But our PGY1 experience is really vast here. They can do a whole bunch of experiences. They can have a lot of outpatient experience as well as inpatient in all of our ICUs. And then we have a large cancer center, so they can rotate on inpatient hematology, stem cell transplant, oncology. So our PGY1s really get a really strong overview here.
Overview of everything. That's great. And I think we can kind of transition to some of the fun questions because we always ask this, and we tell people what we do, and no one ever knows. What's the thing that you wish like the public, the lay public would know about ED pharmacists?
I think the big thing that I always tell people is that I'm not counting pills. And I think so many of us say that, and it definitely sounds a little cliche, but I think that people think I sit in a pharmacy in the emergency department, and I'm like, that is not my job. And we were talking about this earlier, but I always sort of describe it to people that I am like an anesthesiologist in the emergency department. If you need something majorly done, like a breathing tube placement, I'm the one who decides what medicine you get and what dose, and then everybody's like, oh wow, cool. And so I think that if the public could know that there are clinical pharmacists and what that really means, it would help.
That's the big thing. And then the fun question that we have, what's the one thing that you love about Chicago?
Oh, so many things. So I'm born and raised, so there are a lot of things I love. Not the traffic. Definitely not the traffic. I think one of the things I love about Chicago the most is the neighborhoods. So we have very distinct neighborhoods, and you can very clearly tell from when you leave one neighborhood to the next, there's a different vibe, a different culture. And it's sort of like what you're in the mood for, right? Like if you want a fun night of getting tacos and margaritas, you go to Pilsen. If you want like a cool dive bar, you go to Logan Square. And it's just really nice to have all of those options at your fingertips here. And then obviously our food is the best. We have amazing sports, go Bears, even though we stink, but go Bears. So we have a lot of great things here in Chicago, and like 10 hospitals to choose from. We have a lot of hospitals.
My big thing I like to tell people, they say, why do you always go to Chicago? I say, for ED pharmacists, this is like the research triangle. Like you think of like the Wake Forest, North Carolina, Duke, of the North Carolina, this is like the triangle of ED pharmacists here. So again, it's probably 50 or so of pharmacists. You guys have your own group that you guys do things together. So I always admire that because it's probably like a 5 or so ED pharmacists in Charleston. So it's something. It's hard. Something. So
we've got a strong crew here. That's great.
So that's great. Anything else you want to tell the world about the hospital system, or about Chicago, or just something just unique about the program?
Sure. I think a big thing for us is to respect your healthcare workers. If you have a healthcare worker in your family, next time you see them, give them a hug. Say thank you. I think we've all been through the ringer the last couple years, and I think for us it's really interesting, and I don't know if you felt this way too in the South, but we actually weren't hit that hard from COVID. Like it was sort of slow. It's actually the after effects of all of this COVID stuff that's hitting us even harder. And so all of those things, like people were so appreciative during COVID, but it's actually now that we're struggling and seeing the aftermath of everything. And so, just hug your healthcare workers today.
Absolutely. All right. Thank you guys again. It's been another great episode on Pharm So Hard, and we are going to have a lot of fun in the sun in Chicago. Thank you.
Thank you.